Welcome back again in another important concept learning in ATT-induced drug-induced hepatitis or drug-induced liver injury management. So very often when we start our patient of tuberculosis treatment with anti-TB drug, especially with the first line drug, so they develop drug-induced liver injury or simply drug-induced hepatitis. So what we do, the first thing for us to know that what pattern of injury the patient is having. Why this is important? Because if we know the pattern of injury the patient is having, we will able to know the culprit drug that is responsible for the drug-induced hepatitis, and that is going to help us later on when we start drug ramping. So how to do that? So the very important point to understand this, just simply calculate the R factor. Okay, so if we calculate the R factor, simply calculate the R factor. R factor is nothing but simply calculated by using lab values of the LFT, ALT and LFOS values. So simply you can use this formula to calculate R factor, or you can go to the MD Plus calculator that is available online, and also it's available in the Play Store mobile application. You can put the values and you will find out you will calculate the R factor it's going to give you. So once you have calculated the R factor, it is divided into three groups. One, when the R factor is more than 2 and less than 5, it suggests mixed pattern, and in that situation the likely drug, the culprit drug for drug-induced hepatitis is Rifampicin, although it can also be Isoniazid and Pyrazinamide, but Rifampicin seems to be the most likely drug. Alright, now if R factor comes to less than or equal to 2, then this pattern of injury is cholestatic pattern, and here the most likely drug that is causing the drug-induced hepatitis is Rifampicin. Alright, and if R factor is more than or equal to 5, it suggests hepatocellular pattern, and we know that the drug responsible for hepatocellular pattern of injury are Isoniazid and Pyrazinamide. So calculating the R factor will give us idea to understand which drug is causing the injury. Okay, it is definitely going to help us in the clinical management when we start drug ramping. Once the LFT parameters are normalized, then we will able to know which drugs should I start first and which one to start later. So that is a very important factor to calculate whenever we deal with the patient who has developed drug-induced hepatitis. Very simple to use and it's very helpful also. Simply you can go to the MD Plus calculator, or if you want to calculate by yourself you can use this formula, or simply you can go to the MD Plus cal. So MD Plus calculator, and in the search box write R factor, and it will give you, the window will open, and here just you have to fill the value. So if the patient values ALT value is, say it's 80, okay, and LFOS is 150, so it will give you the R factor 1.6 suggestive cholestatic injury. Alright, so if you have calculated R factor, it is suggesting cholestatic pattern. So now you can understand that most likely in that situation, in this patient, the cause of hepatitis seems likely because of Rifampicin. Alright, so this is very important factor to calculate whenever we are coming across a patient who has developed drug-induced hepatitis. So do use this factor in your patient management, and definitely it is going to help you in the clinical decision making.